One of the most frustrating things after having bariatric surgery for weight loss is the weight coming back. About one third of patients after surgery will regain weight. So, one of the common issues that arise is what to do about this. So, we know that one of the options is to take another medication for weight loss. And one of the most popular options for that is a GLP-1 medication. So here's two studies that have investigated whether taking a GLP-1 medication after bariatric surgery will help. The first one is from this journal, JAMA Surgery, pretty good journal. It studied liraglutide, also known as Saxenda, 3 milligrams once a day versus placebo. And patients were randomized to these two conditions. Now, in this case, they took patients who were 1 year after surgery, and they wanted to see if among these patients who had less than 20% weight loss after surgery, could they get them to lose more weight by giving them either liraglutide or a placebo. In addition, they made sure that both groups had a 500 calorie per day nutritional deficit, and that was common between the two groups. And what they found is that the liraglutide group had about 8.8% weight loss, and the placebo group had fairly of negative 0.5%, as you see here in the results. So that's a significant difference. And what does that mean? Here you can see the weeks of the study over 24 weeks, and here you can see the mean change in body weight. Placebo group didn't change very much, and the liraglutide 3 milligram group got down to an average 8.8%. And these are the actual patients. You can see how much each person lost that was enrolled in the study approximately. And some of these liraglutide patients even lost up to 25, 28%, and some of them lost very little, but on average, you can see that they lost a lot more than the placebo group, where probably half of them gained weight, half of them lost weight, and overall it was a wash. So that's one study. There's also another study that was done also in 2023, and this study was done by a different group, and they were also studying liraglutide, also known as Saxenda, but they also studied semaglutide, also known as Wegovy, and it also has other names. But the idea was similar. They wanted to see whether the weight regain that occurs after bariatric surgery could be treated by these medications. So here they provided patients for 6 months with either liraglutide or semaglutide, similar to the other study. And also similar to the other study, they found pretty much identical results that about 8.8% weight loss occurred during this time. So after 6 months, reduction in weight and BMI of 8.8%. And that may not seem like a lot of weight loss, but it's approximately two-thirds of the amount of weight that was regained was lost after these medications were provided. So that's pretty good. You're getting back two-thirds of what was regained. So further confirmation that this could be a promising approach. In addition, these interventions seem to be relatively safe and well tolerated. And the reason it's not obvious that this could work is because you might assume that, hey, these medicines work for people in general, but we can't always assume that they're going to work after surgery because things change after surgery. Your gastrointestinal tract has changed, your hormones have changed, your physiology has changed. So it's nice to see that these medications also do work after surgery. Here's a schematic diagram that shows you BMI before surgery and then after surgery and then 6 months after treatment. So here you can see the average BMI somewhere around 43 before surgery. After surgery, it drops a lot, almost to about 30. And then people regain a lot of that, get back to about 35. And then after the medication, they go back down here. And again, it may not seem like a lot, but there is a significant portion of patients who even regain all of the weight after surgery. So this may be a promising avenue for intervention. In addition, there's some other ways of representing this data here. You'll see that this is a plot on the right that shows you the difference between the groups, semaglutide and liraglutide. It looks like semaglutide lost a little bit more weight than liraglutide. So this is Wegovy versus Saxenda, and we know Wegovy is more effective than Saxenda in general for weight loss, and we see that here as well. So you're getting closer to 4 BMI units lost on semaglutide. Similarly, if you look at this graph on the left here, we can ask the question of what percentage of the patients lost 5% of their weight, lost 10% of their weight, and lost 15 or more percent of their weight. And the semaglutide group is this blue graph on the right, The liraglutide group is the light blue graph, and then both of them combined is the darker graph on the left. And what you can see is that both 5% and 10% or more and 15% or more, the semaglutide group is always bigger than the liraglutide group, both here and in the 10% group and in the 5% group. So what that means is that for all of these conditions, people are losing more weight on semaglutide, and a higher percentage of people got to this level of weight loss with semaglutide than liraglutide. So semaglutide seems to be more effective for this purpose. So in conclusion, I hope this has been a helpful overview, and I hope I've been able to help you think about some interventions that might be effective after gaining weight back after bariatric surgery. Thanks so much.